Hello everyone and welcome to Module 4, COVID-19 Risk Factors. The goal of this module is really to take what we know about COVID and talk about how we can apply that to each individual facility to determine where we get the most bang for our buck as far as mitigation practices go. So that said, it's important that we review risk and what taking a risk-based approach means to controlling this COVID-19 pandemic. So Martin covered this in Module 2, but just a quick review here. We have hazards and then we have risks, and it's important that we distinguish between the two. So when we talk about hazards, we know that the definition there is that we have an inherent property of an agent or situation that has the potential to cause adverse effects. So SARS-CoV-2 in and of itself represents a hazard. And we know that that virus can lead to adverse health consequences. But when we look at risk, we take into account the likelihood of that happening when we're in any given situation. So risk is the probability of that adverse effect happening in an organism, system, or population caused under specified circumstances by exposure to a hazard. So the example that we have here is being sneezed on by a COVID-19 case when that person is within 2 feet carries a higher risk of getting infected than, say, touching a surface that was previously touched by someone who has COVID-19. So when we take into account the probability, then we're evaluating risk. And it's really important that we do that when we're thinking of how to control COVID in our facilities. So the bottom line here is that nothing is zero risk. However, it's really useful that we evaluate strategies based on what situations would be more risky for the workforce, because that means we can focus on areas where successful transmission to a human is most likely or reasonably likely to occur. Otherwise, we're wasting time and resources and actions, and that could also lead to some unintended consequences. So for example, if the management team determines that they're going to tackle every scenario under the sun that could lead to COVID-19 exposure, then you're going to have a lot of resources going in many different directions, which could mean that they're not implemented as effectively. Or the workforce may say, you know what, this is a ton of work, and they may start taking those precautions a lot less seriously, just in terms of a culture and mindset. So the bottom line recommendation to site management and supervisors is that you should conduct a risk-based assessment evaluating where COVID-19 is most likely to infect your specific workforce in your facility, so that you can focus on what matters most, and you can perform those mitigation practices in a way that's really effective. So when we talk about that, we want to evaluate this based on an individual level, on a facility level, and on a community level when we're looking at different risk factors. And these will influence where we place the most effort and resources in our operation. It will influence the type of interventions that we ultimately decide to implement. And if we evaluate risk and do that properly and evaluate, individuals in our facility, the facility itself, and the community that we're a part of, we can reduce the burden of illness on the workforce, and by doing that, we're also limiting the burden of the impact of COVID-19 on your business operation as well. So how do we evaluate risk on a facility by facility basis? There's a few different factors that we need to think about. So the first, on the left-hand side of the screen here, we see that there's different virus transmission factors. So the top bullet, direct transmission. Examples of direct transmission, and Al covered this in the previous module, would be respiratory droplets getting from one person to another, or close or direct contact with someone who has COVID-19. Whereas indirect transmission would be transmission through contaminated surfaces, and then Al also talked about food-related cases in the previous module, which are much less likely to occur. So As far as indirect transmission goes, our risk is a lot less than if we have someone exposed to the virus through direct transmission. So right there, we're already thinking about probability as far as risk goes. So those are some factors that we need to consider from a virus biology standpoint. On the right-hand side, we talk about our facility and workforce factors. So things to think about there is, who is our workforce? Where are they coming from and where do they live? Are they in group housing? What communities are they coming to us from? And what are the factors there? Thinking about transportation to and from work. Vaccination coverage. So now we're at the point in vaccine rollout where we're seeing an increasing percentage of the population become vaccinated. But what does that look like for your individual workforce? And then facility layout and workforce density, as far as just how people are physically spaced throughout the facility, is another important factor. So we'll delve into all of these different factors and talk about what they may mean for your individual plant's mitigation. We'll start out with the who. So understanding who your workforce is informs your risk level. Examples here are, what if you have an aging workforce? So a high percentage of your workforce is in the aging population. That's something to consider. If you have people who are nearing retirement compared to a bunch of 18 to 25-year-olds working in your facility, that can impact how we need to be thinking about mitigation and the risk level for the individual person in your workforce. And then underlying medical conditions and comorbidities. And this is one that may be a little bit more difficult to discern, but just kind of thinking about the people in your workforce, and do we know that a good percentage of the workforce has diabetes or high blood pressure or things like that. Now, there are some situations where you may have employees who have an underlying medical condition that you may not know about, and we need to take that into account. But just getting a feel for your workforce and thinking on a person-by-person basis, how at risk of a population are they for having really serious adverse consequences from the virus. And then we also have communication factors. So do you have a workforce that has that English is not their first language, or they have limited English speaking ability? Because that's an important factor in how we communicate these strategies in general, and having a plan for that. So it's not to say that people who do not speak English are at an increased risk for contracting the virus, but it is to say that communication with them should be a priority, and making sure that everyone's on the same page is going to be a really important factor there. So as far as who, we need to understand that very, very thoroughly on a facility-by-facility basis. Then we have where. So we should understand where our workforce spends time outside of work. So what is the housing and living environment? Is this a seasonal work crew where, let's say, we're in a produce operation and it's a mobile work crew and there's group housing? That's going to be a major factor in how we think about mitigation at the facility-by-facility level, versus if we have a population where everyone, a good part of the population, goes home to a subdivision in separate houses, and they drive to work separately every day. So things to think about from a housing and living environment standpoint are they in group housing, and are they a mobile work crew that stays together and travels together? Another thing to think about is the caseload based on the location where the employees live. So if you, let's say you are on the county line, and your facility is pulling people from a variety of different counties or a variety of different areas that have vastly different COVID-19 caseloads, that can make a difference on how you perform mitigation. So understanding what's going around in the communities is going to be important. Along those same lines, we should understand how our workforce gets to work. So are they having to take public transportation, where there's increased exposure risk there just to get to work, much less do things like go to the grocery store and things like that. Does a good percentage of your workforce carpool? Are they all riding together in some way, shape, or form? Because that can make a difference as well. Or are they using personal vehicles, and most people are driving to work on their own, and they're not spending time together in an enclosed space during the transportation process. And then vaccination coverage is, of course, new and evolving. So what is our workforce vaccination coverage? What percentage of your workforce is vaccinated? And acknowledging if you do have a population in your workforce that is hesitant to get the vaccine. And if that is the case, understanding the why behind that is really, really important. So if there are concerns about getting the vaccine that are related to kind of logistics of, well, I don't really know how to sign up, and if someone showed up with a vaccine, I'd take it, but I'm not going to make the special effort to go get a vaccine. That's something that you as an organization can work on to increase that vaccination coverage rate. I would highly recommend understanding your workforce just as far as if they are hesitant, why. Sometimes there's solutions to that to increase that rate, and other times there may not be a solution. You might not be able to convince somebody to get vaccinated, but understanding what the intention is there is really important. And then we have facility and structural and situational factors. So evaluating close contact in the plant, which would include the length of time people would spend in a close scenario together, how far away they typically are from one another, what type of activities the employees need to engage in, and how often close interactions need to happen, are going to be very, very facility specific. So again, these are variable based on kind of how the facility is designed, the type of work that needs to be performed, and a lot of other factors. So this is where things get tailored to facility and structural design. So more specific examples, does your facility have plenty of space to spread employees out, or is it difficult to separate employees adequately? Are there hands-on operations requiring multiple people, so a lot of physical labor, or is there a lot of tasks that can be accomplished with one person at a time where they don't need to be in close contact to perform a specific operation? And then thinking about kind of your worst case scenarios, how, from an organizational standpoint, can you operate with a reduced workforce, or what percent of your workforce do you truly need in order to keep your doors open and operate? So obviously we want to prevent the spread of COVID-19 so that this doesn't become a major issue, but thinking about it from an operational standpoint. And it may be the case that you might have certain sections of your process or operation where you need 90% of your workforce there to operate, but there may be other areas that you need closer to 75 to adequately operate. So thinking about that from an operational standpoint helps frame mitigation practices as well. And then general facility layout and flow. So you probably have areas in your facility where there are some higher risk areas as far as direct contact goes. And then you also have areas that are, meant for congregational activities like break rooms and locker rooms. So thinking about how to, what you need to do to adjust those structural and situational factors to make your risk of direct contact low is going to be important. And again, you may have a huge break room and it's never full, and you need to spread people out, and it's easy to do. Whereas you may have a small break room and everyone usually shares tables, and we need to get creative with different strategies to avoid direct contact. So evaluating situations there is helpful. The next module covers COVID-19 control factors, but facilities must look at their own risk-based approach to develop their own policies and procedures for their workforce and facility. So once management has evaluated risks based on, focusing on what matters most for any given facility, solutions can be created and implemented. And I just want to say here that if we've seen nothing else through this pandemic, we've seen that information emerges quickly and that risk factors can and will change over time. So you as a management team need to be nimble in your ability to adjust based on data that we get. And that's part of the scientific process, right? We're going to come out with more information, and that's going to change how we do things, and it's going to change what is recommended that we do. So just keeping in mind that this will need to be reevaluated, and that's part of the normal. So overall take-home messages here. We know that we can't address every single hazard reasonably and do a good job on executing that, and that's why we're going to take a risk-based approach. And facility management should conduct a risk-based assessment evaluating where COVID-19 is most likely to infect the workforce. So again, we talked about community transmission factors and transportation and your production operation and how risky that is from a SARS-CoV-2 perspective. So think about both evaluating internal and external factors when it comes to risk is important. And then again, be prepared to reevaluate that risk over time as more information comes out. With that, thank you very much, and I hope you tune in to our next module.